So there you heard it, a headmaster and a professor of educational leadership talking about the food shortage in senior high schools. But moving on to other stories, government's handling of COVID-19 expenditure is under scrutiny. The Auditor General has, in a special report, detailed various infractions said to have caused the nation to lose millions of cedis. In some instances, monies were either misapplied or used unlawfully. Ambulances paid for are yet to arrive, while some medical facilities bought with public funds have ended up in private facilities. Specifically on COVID-19 vaccine procurement, the Ministry of Health, on behalf of government, paid an amount of $120 million to UNICEF and AVAT for the supply of vaccines. Just 5.8 million doses have come in so far. This is valued at $38.2 million. The ministry has been asked to recover the amount outstanding. Dr. Patrick Kumabwaje has been speaking on this particular matter. We'll be taking you there shortly to pick the live interactions on that. But now let's take you to other stories where we understand that my colleague Mapito CDB is following up on a development having to do with regards to the issue about an expenditure there. Now, okay, so we'll bring you details of that particular story later on, but let's take you to some schools where we understand 40 students have been arrested for vandalism at Krobia Asante Technical and Vocational School in the Ashanti region. The 40 were among scores who went on rampage on campus on Sunday morning, protesting the poor result of their predecessors in their final examination. The institute has since been closed down following a directive from the Ghana TVET service. About 4 government vehicles, including a Mahindra and Isuzu pickup trucks and a Nissan Patrol and a school bus, were vandalized. A Toyota vehicle owned by the senior house mistress was also damaged. The student also turned over another saloon car owned by a teacher. Love News sources say the school store was also invaded by the student, resulting in the destruction of food items and other supplies. The students made an unsuccessful attempt to break into some bungalows, but damaged part of the buildings. The police intervened to restore calm on the campus. The Ashanti Regional Director of Education, Dr. Ano Ankra, together with the District Director of Education, have since visited the scene. So let's take you back to the COVID story, where we understand government has paid for some COVID vaccines that have not been brought into the country. Some monies have also been misapplied in terms of COVID expenditure. Dr. Patrick Kumabwaje is Director General of the Ghana Health Service, and he joins us with more on this. Doc, grateful that you could have time to join us. Has this finding come to your attention, and what do you know about the effort to try to retrieve the monies that have been locked up at places where we should have had COVID vaccines from?
Thank you, and good morning to your listeners. Let me just give you the way these procurements are done. We bought about 16.9 million doses of Johnson & Johnson from the ABAT facility, which was an AU intervention at a time when African countries were not getting vaccines. Normally, for vaccines, because of storage and cold chain, you don't take all that you buy at the time. They come in schedule so that as and when you need them and you have the capacity to store them, I mean the cold fridges across the country, then you can take. Otherwise, they'll come and get stored, or they come in large numbers, you are not able to deploy, then they expire. So it comes to the schedule. And that is what it is. And so, as we speak now, we have received a little over 6 million doses. We are the ones who are delaying the delivery of the vaccine because of storage, and also since the last few months or a year or so, there have been a lot of donations, maybe small 500 here and there, for us to vaccinate. And so we're trying to mop up that so that we can look at the rest. So it's not as if we have just been negligent in trying to look at, but all those things come in terms of schedule. When you procure, there's a schedule. UNICEF comes in because UNICEF has the capacity to procure and manage the logistics of vaccines, which is a very complicated. But they've done it for children vaccines over the years, so we always use them to do the facilitation. So they just receive the funds, transfer to the agent, and are able to use their Copenhagen office to manage the cold chain and get to the country. So that's why they come in. Yes.
So what you're saying is that the monies have not been lost. We're only waiting for time for these to come in.
We just have vaccines that we can get, and based on even our gaps that we have over the years, since we don't even know how many doses people are going to need, we still have a large gap that even with this, beyond that, we may still need vaccines. Fortunately, there are a lot of donations here and there that is using to plug the hole, and it's not because it's been lost. Yes, so we've not received all, but if you have received 16 million at a go, can you imagine what we'll do with it? It will all expire.
Okay, but how do you also explain the instances when ambulances that have been procured have not arrived in the country, as well as medical facilities that have been bought with public funds ending up in private facilities? How do you respond to that one?
Well, I've not read that part of the report. I'm just responding to the vaccine area. And the ministry is going to come up with a comprehensive report, brief statement on the vaccine acquisition. So I would like to say I don't have the details of what you are saying. I would have to appraise myself of that and be able to see how it happened and what are explanations, if any.
But I know that in terms of auditing, the Auditor General gives a chance to the organizations involved to try to offer an explanation. Why didn't this explanation get to the Auditor General?
Well, I mean, they talked about, they were given information, but they came to their conclusion. And I'm sure, especially the vaccine, those things may have come. But if you read the recommendation, make effort to look at that. Maybe they think that because of other options, we may not need all the vaccines because we are paid for it. There's nothing wrong with reopening negotiation, see whether you can use the number that you bought and then get some money back. I can see that in what they are trying to respond to, that maybe we can still take some of the money back and probably do other vaccines or do something else back. But those responses, I believe, were given in terms of all these logistical procurement schedules, and because of the expiry date and warehouse, and you need to have a schedule that you are able to store. You also don't want to be paying us on when you need it, because you may not have it when you need it. It may not be available when you are going for the next stop. So those are decisions that one may make based on the situation on the ground at the time that these transactions will be taking place. We do that for family planning, we do that for vaccines. If you pay for vaccine, you pay for the year, but they don't come at once. They come in bits, as and when, so that they don't expire and you don't overwhelm your cold chain.
Okay. So what steps have been put in place to ensure that the monies that can be, retrieved are being retrieved?
I believe the statement for the ministry explained that, but I think if the decision is that we want to reduce the quantity we bought, it's a question of reopening negotiations with ABA, see how, based on the contract arrangement, what can be done to look at it.
But looking at where we are now, do you think we have to renegotiate to reduce the quantities because of probably the rate at which we have vaccinated the people?
No, we still have a large number of people who have not taken their second dose. You have only 3 million people who have had their booster. We don't even know, after some time, but based on further studies, whether a second booster will be needed. So you cannot say you don't need vaccine.
You mentioned earlier
that gap that we designed as that, we don't have it because of a bit of the hesitancy. People are very reluctant to take. And so that's why we are doing campaigns to continue to. We still have, we have about 9-10 million who have had one dose. And they will need, about 12 million who have just one dose. They will need their second dose. And all that are gaps that are available. So there may be other options of vaccines if those things are open. Those are all that will come together and see, do we still go for the Johnson & Johnson, or we can see whether we can negotiate ourselves out of it.
Okay. All right. I'm grateful to you, sir, for your time.
You're welcome. Thank you.
So that's Dr. Patrick Kumabwaji. He is the Director General of the Ghana Service. Now, Joseph Akaple is with our research desk, and he joins us with more on this report. Joe, run us through some of the highlights of this report on COVID-19 expenditure. Government has been directed to recover some $81.8 million worth of vaccines.
And so, Brace, first on the issue regarding the ambulances, which you were trying to get some answers from the Ghana Health Service on, the report indicates that the ministry entered into a contract on December 15, 2021 for the supply of 26 ambulances valued at $4 million. We are told that a little over $600,000 of that amount has been paid, but the ambulances have not been delivered. And so the chief director has been asked to ensure that the ambulances are delivered by March 2023. On the medical equipment angle, these were valued at $110,000 and others which were valued at 7,895 cedis. They were issued to a private hospital, the Christ Leeds and Specialist Hospital. The facility did not serve as an isolation center, neither did we receive any COVID-19 patients. And so the report notes that management could not offer any reason for the infraction. The items could have been utilized in the public health delivery. And so the recommendation is that the chief director should immediately investigate the allocation, and also that the facility should be made to pay for the equipment at the current cost, failing which the amount should be recovered. The final finding that we can touch on has to do with the information ministry. The report indicates that during the review, it came to light that the staff of the ministry and other supporting staff were paid a total amount of 151,500 cedis as COVID-19 risk allowance for coming to work during the lockdown period. You recall there was a period that government imposed lockdown and a lot of people, various professionals, were not allowed to go to work. So because they were going to work, they decided to pay themselves risk allowance. The Auditor General says that this is contrary to the presidential directive, as well as without the approval of the Chief of Staff. And so the recommendation is to the effect that the amount should be recovered either from the beneficiary staff or the various officials at the helm of affairs be made accountable for those months.
All right, grateful to you, Joseph Akaple there. Moving on to other stories now.